Hey, so this is my presentation on chapters 1 and 2 of Ramachandran. Our topics are Capgras, smell diagnosis, phantom limb, phantom pain, dyscalculia, memories, and smiles. And my topic is Capgras. So Capgras is referred to as a delusional misidentification syndrome. This disorder results when someone believes that a person or persons has been replaced by doubles or imposters without any changes in the physical appearance of the misidentified objects. So if you can see the picture right here, you see that someone sees a familiar face, but they can't really connect with them emotionally because they believe someone is different deep down. So the first report was known in 1923. Where this lady was 53 years old. She was labeled as a paranoid megalomaniac woman, and she transformed everyone in her life, even her husband and daughter, into various and numerous doubles. So with Capgras, you also believe that everyone that you come across has evil intent. So a 70-year-old man was diagnosed with dementia and Capgras. He claimed that his wife was the same in appearance, but he showed occasional violence toward her. And in 2 months preceding before he was hospitalized, he set fire to his house in order to kill her. So originally it was associated with schizophrenia and other mental disorders like cerebrovascular disease, subarachnoid hemorrhage, head injury, epilepsy, pituitary tumor, pseudo-hypoparathyroidism, and myxedema. So here's a person's brain on Capgras, and you can see that, as the picture says, in the left anterior insula and the anterior cingulate, there is severe activation, or just lots of activation going on. So according to multiple case studies, it's not necessary to have intact vision for Capgras. It can also be associated with hearing and touch as well. So one of the main theoretical models of Capgras says that a person can recognize another's face, but they fail to receive confirmatory feelings of familiarity because the occipital lobe is not connecting with the amygdala, which is the gateway of the emotional center of the brain. And so the information of facial recognition is overridden by the fact that they perceive the person as an imposter. Here's a picture of someone's heart disconnecting with their brain, kind of tearing them apart, your feelings versus your brain. Or another model that I think is probably more accurate is that the eyes are connecting with the occipital lobe, but that occipital lobe connection is not going to the amygdala, so it can't connect to the limbic system. So delusional misidentification syndromes can be classified as a psychiatric disease, a neurological condition, and neurodegenerative disease, or another associated disorder. So neurophysiological and neuroimaging studies have shown the presence of identifiable brain lesions, especially in the right frontal lobe and adjacent regions, in a considerable proportion of patients with delusional misidentification syndrome. So on the picture on the left, you see a 71-year-old healthy subject, and you can see there's a lot of activation in their brain. They still have most of their brain matter, but the one on the right is someone with Alzheimer's who is also diagnosed with Capgras syndrome. You could see that they have a much wider area in the ventricles of the brain. It looks like they've lost considerable brain mass, and there's also considerably less activation going on in the brain during those times. And here is my reference for my article. And that's it. So, thanks.